Welcome back to Pherl TV, okay? So for this afternoon live streaming is we are about to review about Alzheimer, okay? Alzheimer's disease and its prevention, okay? Prevention of Alzheimer's disease, okay? By the way, guys, the book that I'm going to use in this review is the book of Dr. Willie Ong, okay? I bought this book 10 years ago maybe, and we will review, okay? We will review in order for us to be reminded with that Alzheimer is a very serious disease. Okay? Seryosong sakit ang Alzheimer at importanteng malaman natin ito at maiwasan din kung tayo ay inaatake na, okay? So ako feeling ko ako ay inatake na ng Alzheimer's, may symptoms. So natatakot ako, guys. So in this afternoon live streaming is, ang tatalakayin natin ay Alzheimer's disease, okay? Ano ba ang Alzheimer's disease, okay? Sabi dito, ang term na ginagamit to describe itong loss of memory nga is dementia, okay? Dementia ang ang usual na tawag sa Alzheimer's. Sabi dito, dementia is a term used to describe the loss of intellectual and social skills serious enough to interfere with the daily living. Oo, ako minsan ganun ako, guys. Yung tiyanik nga, hindi ko talaga matandaan kung nasaan na yung tiyanik ko. Ilang gabi ko nang hinahanap, ilang linggo ko nang inaalala, pilit kong inaalala kung nasaan na yung paborito kong tiyanik. Kasi ang dami kong tiyanik dito sa bahay. Yung tiyanik na gustong-gusto ko, na regalo ni sister ko, pambunot sa buhok sa kilikili, hindi ko talaga mahanap. Okay? At hindi ko talaga ma-recall kung saan ko nilagay. So sabi ko, is this a symptoms that something is wrong with me? Kasi hindi ko talaga matandaan eh. Chinek ko na yung mga dating minsan nagkakamali ako na nilalagay ko doon, hindi ko talaga mahanap. Okay? So sabi dito, there are several causes of dementia. But the most common cause found in 50 to 60% of the cases is Alzheimer's disease, okay? Sabi dito, Alzheimer's disease affects 5% of the population of 65 to 74 years old. Imagine mo imagine mo yan, no? Ang ina-apekton daw ng Alzheimer is 65 to 74 years old. Pero ako napakabata ko pa, di ba? Para atakihin ako, pero may symptoms niya. And 30% of the people above 85 years, okay? So in fact, in the US, half of the people in the nursing homes have Alzheimer's disease, okay? Yung home for the aged siguro ang sinasabi dito, no? Nursing homes for the adults, okay? For the olds. Okay, 30% daw, ay half of the people, okay? 50% ng mga tao na nasa home for the aged daw sa US is they're being attacked by Alzheimer's disease, okay? Sabi dito, in patients with Alzheimer's disease, the brain cells get damaged and die, okay? Ang brain cells daw natin sa utak nasisira at namamatay. Okay, kaya ganun ang nangyayari. The normal interconnections between the nerve cells in the brain are disturbed. Okay? Similar to a computer will faulty wiring. O, parang, di ba kasi madami tayong mga nerves sa utak, di ba? Interconnected yan. So, kaya pag nadadami siya, hindi natin ma-recall. So, something's wrong with me. Kaya ako, nagustuhan kong i-discuss to kasi ma-review din ako, okay? The scenario causes a progressive loss of memory and thinking ability. Ayun, hindi ko talaga maisip kung asan ko talaga nilagay. At present, medical science does not have a cure, but doctors can help improve the symptoms, okay? What causes Alzheimer's disease? Sabi dito, ano daw yung dahilan kung bakit ang isang tao ay nagkakaroon ng Alzheimer's disease? Sabi dito, we are still not sure, but the expert theorize that it's a combination of hereditary factors, genetic, okay, namamana daw, or poor lifestyle habits, overeating, ayun, malakas kumain, overeating, and possibly environmental factors that can affect the brain, okay? In less than 5% cases, there is a specific genetic culprit for the disease. Okay, yun, sinasabi nga ng ilan na namamana talaga daw ang Alzheimer's, pero minsan depende din sa sa eating habits, sa lifestyle, sa environment. So halo-halo na yung mga halo-halo na yung mga dahilan kung bakit ang isang tao ay nagkakaroon ng Alzheimer's disease. Okay? So ako kinabahan ako doon na ilang araw ko nang nire-recall saan ko ba nilagay yung chani. Hindi yun lang yun eh. Wala yung ibang paglalagyan. 3 lang. Wala. Hindi ko maalala talaga. Okay. Sabi dito, ito guys na ginagamit kong libro to ni Doc Willie. Binili ko to na libro. Okay? Mahilig kasi ako magbasa guys kung ano-ano pinagbibili ko. So pag kinabangan natin at reviewin natin. Okay? Para at least marami ang maging aware at may matulungan tayong makaiwas. Okay? So ang sabi dito, ano ang sintomas ng Alzheimer's disease? Okay? What are the symptoms of Alzheimer's disease? Sabi dito, ito na, number 1 na yung sinasabi ko sa inyo guys. Increasing forgetfulness. Lumalakas yung pagiging makakalimutin. Okay? The patient will have difficulty remembering the names. Ayun, minsan, nakakalimutan ko yung name ng kausap ko. Or where they left their things. Ayan na, sa akin na yan. Kung saan ko nilagay yung gamit ko. Okay? While everyone has some lapses, the memory loss in Alzheimer's disease is more severe, okay? A common first sign is the loss of short-term memory. What they just did a few minutes ago, ayun, isang symptoms daw yan guys. Ano yung sinulat mo kanina, ano sinabi mo kanina, diba? Isang ano daw yan, sintomas yan na may ano tayo sa Alzheimer. Nakakatakot ano, kasi pag nagka-Alzheimer ka na ako, tsaka bata pa ako para magka-Alzheimer. Nakakatakot ang Alzheimer guys, 'di ba? Alam niyo kung bakit? Meron kaming mga nearby mga kakilala dun sa lugar namin, si papa nila merong Alzheimer, okay? And then one time, punta yata ng Manila, tapos inatake ng Alzheimer, hindi na nila mahanap talaga. Nakarating daw sa Quezon province. Tapos, ayun nga, pinost na nga nila sa Facebook, hinahanap nila si papa nila. 2 years ago na, hindi pa nila nahanap ngayon. Kasi nga si papa nila, ewan, hindi niya, sabi, may nakakita na, tapos kinuha, dinala daw sa Quezon province, tawag nito, police station, at biglang umalis na naman si papa niya at walang nakakita. Kaya grabe yung lungkot ng family, hindi na nila mahanap si papa nila. Ako nga, shinare ko nga din sa FB ko yung picture ni papa nila kasi sabi ko baka may makakita. Kaya grabe ang hinayang nila kasi nga may nakakita na at nadala na nga sa Quezon province PNP station, nakaalis ulit. So wala na makapaghanap, wala na makapagturo kung nasaan. Kaya 'di ba nakakatakot ang Alzheimer's disease. Si papa niya siguro kung mga 65. Okay, mga 65 yung papa nila. Kakilala namin doon sa amin. Nakakaawa nga sila eh. Nakakaawa kasi nga 'di ba imagine mo mawala yung tatay mo. Hindi mo na alam kung anong kinakain, ano ba ang buhay, 'di ba? Okay? Yan. In later stages, patients may eventually forget their names and their close relatives. Ayun. Pag isa daw na sintomas ng Alzheimer, nakakalimutan mo na yung mga pangalan ng mga kaibigan mo, kakilala mo, kamag-anak mo. Okay? And yung mga closest relatives mo. Okay? Another symptoms daw ng Alzheimer's disease, loss of orientation. People with Alzheimer's disease cannot state what year or month or day it is. Okay? Nakakalimutan na daw kung anong month o anong araw ngayon, okay? They may not know that the president of the country, o yun, pati presidente ng bansa, nakakalimutan na daw guys, okay? They may not know the president, they may get lost easily, okay? So, isang palatandaan na, ayan, inaatake na tayo ng Alzheimer's disease kapag gano'n na nga ang okay? Tapos, changes in behavior. Hala, parang ano talaga to sa akin. Parang prone talaga to. Parang ako talaga to. Changes in behavior. You often find the patient wandering around, getting agitated and yelling at other people. Ay, hindi naman. Okay? Struggles to perform daily activities. Simple activities like playing a board game, cooking, and planning the day's work after are the difficult for the patients. Ayun, okay? And then, number 5, another symptoms, harder to talk and write, okay? Patients have difficulty communicating with other people and identifying common objects, okay? Parang nami-mental block na siya pag di ba? Tapos, poor in calculation and reasoning. Ala, parang ako to. Ako na naman to, okay? So, nagiging mahina daw sa calculation and reasoning. One of the tests to detect Alzheimer's disease is to ask the person to count from 100 backward by decrements of 7. For example, 193, 86, 79, 72, okay? And so forth. I'm sure that's easy for you. Okay? So, detestingin mo yung sarili mo. Kung hirap ka, na i-count mo yung 100, 93, 86. Pag hirap ka na magbilang pabalik daw, there's a indication that you have a dementia. Okay, so sige, try natin. 100. Hindi wala tayo sa concentration. Okay, 193. Babawasan mo daw kada ano, okay? Tapos, poor in judgment, okay? If you ask the patient to decide what to do in the case of fire, they may say something totally irrelevant to the situation. Because of these changes, patients with Alzheimer's disease are more prone to complications like developing pneumonia and falling. Ah, yun na nakakatakot. Delikado yun sa pneumonia kasi kung, di ba, basang-basa na yung likod mo, pawis na pawis ka na, hindi mo inano yung sarili mo, magkakasakit ka, okay? Ano daw yung risk factor? What is the risk factor for Alzheimer's disease? Sabi dito, older age group, okay? So, kaya nga ako kinakabahan kasi hindi naman ako ganun pa katanda, okay? Then, family history. The risk of getting the disease is higher if somebody in the family has the disease. Hindi ko lang sure. More women, hindi ko lang sure kung may family history kami ng Alzheimer. More women have Alzheimer's disease, but this may be partly be explained because women live longer than men, okay? Sinasabi daw guys na ang babae may most women have karamihan daw na may Alzheimer babae. Pero ang dahilan daw kung bakit kasi maraming mga babae mas matagal ang buhay sa lalaki. Kung kaya't maraming babae ang buhay pa tapos may Alzheimer at yung ibang lalaki they are already dead, okay? So other risk factors are similar to those causing heart disease. Anong mga sinasabi ditong risk factors? Yung mga nagbubuwid para magkaroon tayo ng Alzheimer's, okay? Other risk factors are similar to those causing heart disease such as smoking, high blood pressure, high cholesterol, diabetes, and lack of exercise. When the blood vessels of the brain are partly occluded, then the chances of getting dementia increases. Ayun. Isang dahilan daw din guys yun kapag hindi tayo nag-exercise, okay? Tapos yung mga eating habit natin ay hindi tama, okay? Okay. So a difficult diagnosis. Although Alzheimer's disease is so common, it's not easy to make diagnosis. Your neurologist will determine if the patient has the disease based on mental status, asking the patient question. Guys, yun nga pala yung dementia pala wala ng gamot yan. Kumbaga aggravating, okay? Kasi may ako magbasa, marami na ako mabasa about din. Wala ng gamot yung Alzheimer's. Once na may Alzheimer's disease tayo, mag-aggravate or mai-slow down mo, okay? Kapag meron na tayong sakit na ganyan, wala na siyang gamot. Pwede mong slow down yan para hindi tuloy-tuloy yung pagiging makakalimutin, pero hindi mo na siya mai-stop, okay? Pwede mo siyang maiwasan kung wala ka pa. Mamaya tatalakayin natin kung paano natin maiiwasan ang pagkakaroon ng Alzheimer's disease, okay? Sabi dito, based on the test, the doctor can accurately identify Alzheimer's disease in the 90% cases. Okay? The definite diagnosis can only be made after death when a microscopic examination of the brain shows the characteristic plugs and tangles. Ayun. Malalaman lang pala guys. Ma-examine yun sa brain kapag patay na yung tao kasi nakikita yung plugs. Alam mo yung plugs guys? Yung plugs is about sa cholesterol. So, it's ayun, yung poor eating habit nga natin talaga, malaki yung impact kasi yung plaques, it's like a cholesterol na nababara sa utak natin. Okay? Na nagko-cause kung nagiging dahilan kung bakit yung pagdaloy ng dugo sa utak natin hindi siya ganun ka swabe. Okay? Kaya nagkakaroon ng dementia. Okay? Caring for the patient. Sabi dito, the neurologist may prescribe drugs that can help reduce memory loss and other cognitive changes. The first line drugs are cholinesterase. Okay, dito na tayo sa prevention guys kasi masyado ng medical chuba-chuba na to. So dito na tayo kung paano natin mapiprevent daw. Sabi ni Doc Willie, kay Doc Willie yung to guys Prevention tips for everyone. Sabi dito, para daw maiwasan ang magiging para makaiwas tayo sa sakit na Alzheimer, gawin natin ang number 1, okay? Be a lifelong learner. Keep on studying. Ayun, itong ginagawa pala natin is another prevention for dementia, okay? Research shows that people with a higher level of formal education have a lower incidence of Alzheimer's disease, okay? Yung mga tao daw na may hilig magbasa, okay? Yung mga tao na they are fond of learning is nalalayo sila sa dementia kasi yung utak nila is laging gising, laging nag-aaral, okay? Number 2, try to find an exciting and stimulating job. Ayun, kung namasaya ka sa YouTube, ayun, gawin mo lang kasi lagi ka from time to time nag-i-edit ka and gumagana yung utak mo. So, nakakatulong siya. Okay. Ito pa, number 3. Continue doing mentally changing activities like playing chess or solving crossword. Makabili nga ng chess, mama, yung chessboard. Or solving problems and Sudoku. Crossword puzzle, Sudoku. Expert believes these activities stimulate the brain to increase its cells interaction and connections, thereby protecting you from Alzheimer's disease. Ayun. So, isang tip daw guys para ma-prevent ang Alzheimer is from time to time we play our favorite hobby like playing chess, playing crossword puzzle, and Sudoku kasi nai-stimulate daw yung utak natin. Okay? Number 4, have many friends. Okay? Another prevention tip para malayo tayo sa dementia or Alzheimer is have many friends. Okay? Enjoy the friendship of older people and younger since they broaden your perspective, okay? So sa pakikipagkaibigan, wala kayong pipiliin kung bata lang or matanda lang, okay? So maging open tayo sa friendship to all, okay? Age doesn't matter in friendship. Kasi bakit? Kapag nagiging kaibigan natin ang mga ahead sa atin, we learn from them, okay? Kapag nagiging kaibigan natin ang mga ahead sa atin, we learn from them a lot. At pag nagiging kaibigan natin, ang mga bata sa atin, we teach them on how to do things, okay? So that's two way. Kung ano yung na-learn mo sa isa, i-share mo din sa isa, okay? Another tip, guys, is have a healthy lifestyle, okay? Low-fat diet and diet high in fruits and vegetable. Ayun. Makakaiwas daw tayo sa sakit na yun, guys, kapag tayo ay kakain ng mga pagkain kagaya ng prutas at gulay at regular na kakainin ito. At regular din na magkakaroon ng ehersisyo at least 30 to 1 hour per day. Okay? Sabi din dito, taking vitamin B complex may help reduce brain shrinkage and prevent Alzheimer's disease. Ayun. So, magbili na tayo ng... Ayan, na-remind ako, bibili ako ng vitamin B. Para sa akin to. Try kong bumili ng vitamin B kasi yun nga, parang something's wrong with me. Hindi ko talaga ma-recall kung saan ko nalagay. Pero pag pera, kung saan ko nilagay, mabilis ko ma-recall. Pero talaga yung chani na paborito ko, hindi ko talaga guys ma-recall. Nakakainis. Okay? So yun, vitamin B complex. Yung vitamin B complex naman, once a day naman nun, pwede naman eh. Over the counter, pwede naman yun. Huwag mo lang i-overdose. Another prevention tip is, sabi dito, preliminary study shows that oily fishes rich in omega-3 fatty acids like sardines, salmon, and mackerel may help protect the brain. Ayun nga, kasi nga yung cholesterol nga kasi merong magandang oil, ang healthy oil, ang salmon, mackerel, sardines, okay? They're rich in omega-3 fatty acids, okay? Kasi ang fatty acids, it breaks the cholesterol, okay? Number 8, at present, there are unclear results with the use of statins, vitamin E, ginkgo biloba for Alzheimer's disease. Ayun, may mga iba daw na gumagamit ng mga ginkgo biloba, pero wala pang pruweba na talagang yun, okay? Number 9, finally, the best prevention tip is to treat other medical condition like high blood pressure, heart disease, and diabetes. If you treat these conditions, then you prevent Alzheimer's disease as well. Ayun nga. Kasi nga guys, di ba sinasabi, interconnected yung mga sakit-sakit. Pag may sakit ka sa puso, mataas ang cholesterol level mo, may diabetes ka, ang tendency, kumbaga nagiging risk factor din yun para magkaroon ka ng Alzheimer's disease. Okay? I hope you guys learned something from this live streaming. Okay? Thank you so much, guys. And if you are just new to this channel, Please don't forget to give a like, comment, subscribe, and ring the bell button in order for you to be get updated, okay? This is your mommy host, Pernita Hobe. Bye-bye! Thanks for watching. God bless.